While most experts recommend annual mammograms starting at age 40, there are some powerful statistics that show the threat of breast cancer increases dramatically with age. In a report published by the American Society of Clinical Oncology, the incident rate for breast cancer is 82 new patients per 100,000 in women younger than 65 years versus 404 per 100,000 for those 65 years and older. The specialists at Florida Hospital Waterman's Digital Mammography Center weigh in on the age recommendations, early detection, and advances in technology for all ages when it comes to digital mammography.
Basically, a woman should have a baseline mammogram between the age of 35 and 40. She should have screening mammograms every year or two between 40 and 50, and between around 50 or 70, she should probably have a mammogram every year. After 70, the recommendations are a little more vague, and going to every other year is probably a reasonable way to go.
Self-examination is a very important tool in addition to the mammograms. What we recommend, and the American College of Radiology as well as the American Cancer Society recommends, especially from the age of 40, a monthly self-breast examination and a yearly physician breast examination in addition to the mammograms. Because there are some cancers that are picked up by self-examination earlier rather than waiting for the yearly mammogram. All women should be doing it every month.
We use digital mammography as a screening technique. It's reasonably affordable, it's easily available, certainly at Florida Hospital Waterman. It's a quick and easy test to get a look at the breast. Women that have very high risk for cancer, that have genetic markers for cancer, sometimes what we'll do is we'll screen them with mammography, and then every 6 months or a year we'll alternate between mammography and breast MRI. Breast MRI gives a different look at the breast than you get with mammography, and it's complementary to mammography. But it's not a test that we use for primary screening.
Now, what makes us very excited to take care of our patients here at Waterman is that we get direct contact with them. The toughest part sometimes of my job is to tell the patient that they're going to need a biopsy. But then when we do the biopsy and the next day we find out it's benign, that's the most satisfying.
The report from the American Society of Clinical Oncology concludes that when it comes to breast cancer treatment, early detection is essential. That 65 and 75-year-old women can be expected to live approximately 20 and 13 more years respectively if breast cancer is caught early. Annual mammograms are generally covered by most insurance plans, Medicaid, and Medicare at no cost to the individual. We've included a link to the American Cancer Society's Mammogram Reminder Service, as well as more information about Florida Hospital Waterman's digital mammography services when you click the Screening for the Ages story link on our homepage at yourhometownhealth.com.